Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this learning project. Hypnosis is a powerful technique with which you can help and improve the quality of life of your future patients. Remember to read the description of this video, where you can find a link to free training classes on clinical hypnosis, and also download several free ebooks. Classical or Ericksonian hypnosis. This type of hypnosis was developed by Milton Erickson, an American psychologist, who is considered a pioneer in this field and in psychotherapy in general. This author should not be confused with Erickson, a German evolutionary psychologist, known mainly for his theory of the 8 stages of psychological development. Ericksonian hypnosis is not carried out through direct suggestions, but through metaphors that favor creative and reflective thinking. Because of this, it is attributed a greater effectiveness in people refractory to hypnosis, with a low level of suggestibility, or who are skeptical with the procedure. Erickson's influence is not limited to hypnosis and neuro-linguistic programming, which we will discuss later. The central aspect of his intervention model, the weight of the relationship between therapist and client in achieving change, was picked up by the strategic school and by brief solution-focused therapy, both part of the systemic approach. Who was Milton Erickson? Erickson grew up in Wisconsin in a farming family and never intended to become a doctor. As a child, he suffered from dyslexia and was also colorblind. At age 17, he contracted polio and was so severely paralyzed that doctors believed he was going to die. In fact, as he lay in his bed, he overheard a doctor tell his parents that he did not think he would make it through another day. Erickson, however, did not think he would give up, especially without seeing another sunset. His determination was such that he fell into what he himself, years later, would qualify as a self-hypnotic trance. It is there where we find the first seed of Ericksonian hypnosis in Milton Erickson's own experience. After 3 days in a state of unconsciousness, he began to recover, but the road was still uphill, as he was completely paralyzed and it was very difficult for him to speak. It was then that he became interested in family dynamics and people's reactions. When he gained better control over his body, he realized that he would never be able to work in agriculture, so he decided to study medicine. He became a tenacious and curious student, 2 qualities that led him to become interested in the secrets of the human mind. At about age 50, the ghost of polio returned. Erickson suffered pain and muscular weakness, which again caused paralysis, and although he recovered his movement through perseverance, from that moment on he had to use a wheelchair. Then he began to use self-hypnosis to alleviate his chronic pain. A profound change of perspective. The Ericksonian hypnosis, as we have said, implies a state of focalization of the conscious attention. This state entails a dissociation in the mind that makes possible to accede to the unconscious abilities of the person. The dissociation is momentary, of short duration. All this leads the person to access a state of deep relaxation. In this state, the unconscious mind is more accessible, more present, and takes center stage. Through access to it, Ericksonian hypnosis aims to create new possibilities in the subject to face challenges, changes in behavior and habits. Thus, it also promotes the learning of new behavior and new patterns of behavior. Erickson himself defines Ericksonian hypnosis as a communicative process with the mind and with oneself, through which the person manages to concentrate on his own thoughts, memories, beliefs, and values that he has about life. Ericksonian hypnosis is an active learning, which seeks to reach a trance state, which in turn allows access to unconsciousness, and take advantage to the maximum of the personal resources of each one. Applications in therapy. Ericksonian hypnosis is a tool that has multiple uses and purposes in psychotherapy. Mainly, it can be used to induce states of relaxation and for the patient to know and experience different hypnotic trance states. It also used to generate emotional states in patients, which can be of well-being. On the other hand, Ericksonian hypnosis also allows access to the unconscious of the person, momentarily blocking the most rational and conscious part of his mind. This facilitates the emergence of repressed thoughts and memories that are currently affected the person's well-being. This type of hypnosis also allows to catalyze and induce change processes in moments of crisis, for example, as well as to facilitate decision-making and to manage painful moments of processes. In fact, it is a technique that has been shown to be effective in reducing pain in people with fibromyalgia, for example. One of the objectives of Ericksonian hypnosis is for the person to regain control over their emotions and thoughts, and to feel secure and firm in their decision-making processes. Suggestion was defined by Erickson as a form of transmission of ideas. People are generally vulnerable to verbal influence from others, sometimes more than they realize. Suggestions are metaphorical communications that inform the unconscious of the conviction and faith that one has in obtaining a result in a way that provokes the necessary resources to achieve the objective. I'll leave you an anecdote we extract from the book, The Hypnosis of Milton Erickson, as shows an example of suggestion. The removal of words is often the cause of many superstitions. Teresa's grandmother was considered an expert in it, and probably her confidence in achieving a positive result influenced enough to achieve it. As a child, Teresa had a few wants. Her father, a doctor, tried several remedies, although he did not intend to remove them surgically, as they were too crowded on the index finger and very close to the bone. One day he told Teresa that he had found a snail whose slime made the warts disappear. In a container whose lid had a hole, the snail was shown to her, and she was informed that to thank the snail for this work, she should give it fresh lettuce every morning. When, after a couple of days, Teresa asked when she was going to put the snail slime on the warts, her mother told her that they were already doing it at night, because she had to be totally asleep for it to take effect. From that day on, the warts were diminishing, and in about 10 days they disappeared. Many years later, Teresa told this anecdote of her childhood about hypnosis to a dermatologist, who told her that he was not surprised, because being a student he had tried, incredulous, covering a wart with a plaster and a cotton wet in water, to demonstrate to the professor that the system that he had explained to them the week before to remove the warts did not work. Their surprise was that then when they took off the adhesive tape in front of the professor to show him that the wart was still there, even after a few days had passed, it turned out that the wart had disappeared. Let's see another example in metaphor. Cupboard of lies, which serves to reframe the interpretation of behaviors. Know what's wrong with you, Joanne. I'm sure you don't know because no one has yet explained it to you. It turns out that all people in our head, it's as if we had a closet. The older people have a bigger, and the small ones smaller. It turns out that this closet serves to keep the truth and the lies. A door to keep the truth, they're all well placed, and another for the lies. What happens is that sometimes this closet, sometimes the doors do not close. They do not close well, and if some door remains open, they can escape us. We could fix the closet doors so that they do not open so easily and close better, do you think? Excellent examples of metaphors and learnings. I especially recommend Ericksonian hypnosis for some infant juvenile treatments. If you're interested in learning more about clinical hypnosis, watch our next video, What is Self-Hypnosis? Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And you can download several ebooks also free. If you have questions, ask them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we will publish. So if you're interested, do not miss our next videos. Thank you very much.